Hello, my name is Karina Fuentes. I'm doing a video on sepsis, and with me I have Michael Lopez and Norma Gomez, and we're going to go ahead and start talking about it. So the definition for sepsis is it occurs when chemicals are released into the bloodstream to fight an infection, and it triggers inflammation throughout the body. So the blood vessels, as the infection enters, the blood vessels get inflamed, and that's where it triggers the infection to spread out throughout the body. So signs and symptoms are a change in mental status, the rise of blood pressure, and the respiratory rate increases, so they start breathing more. Risk factors, very young or very old patients are prone to these kinds of infections. Compromised immune systems, like premature babies, patients that are going through chemo or HIV, because they don't have any way of fighting off any type of infection there. And they're sick in the hospital, ICU patients, people who have had wounds or fighting off infections already, injuries, and devices such as catheters or breathing tubes, because that is a port of entry where the bacteria comes in. Causes any type of infection such as bacterial, fungal, or viral infections, pneumonia, infections of the digestive system, or kidney infections. Prevention, way to prevent is by being vaccinated against the flu or pneumonia, and practice good hygiene. You want to practice that all the time. And then cleaning with the appropriate supplies, like for cuts and burns. And treatments, you want to take your antibiotics and fluids as prescribed by your physician. Surgery may be needed for the reason such as removal of like the pus, the abscess that may form, or the infected tissue, or gangrene. Sometimes people get those type of injuries. So parent teaching that we're going to do today, mom, the first thing you want to do is always have good hand hygiene. You always want to wash your hands and put on some gloves when you're going to be doing any kind of like wound care on your child.
Okay.
Next thing you want to do is have an adequate diet with high protein. High protein, it stimulates body tissue repair, so it'll help them heal a lot faster. Along with that, you want to have adequate fluid intake, so keep them hydrated at all times. For pediatric teaching, you want to be able to take your medication as prescribed by your doctor. So if you have an antibiotic and it's twice a day, you're going to do one in the morning and one in the evening, okay? Or one at night. Another thing you want to do is to always let your mom know if you're not feeling well. So if you have like a temperature or something, you want to let your mom know. And you always want to also have good hygiene yourself. So you want to be constantly washing your hands to make sure that you're not going to get, you're not going to spread the infection, okay? So with that, do you guys have any questions for me?
I don't. Son, do you have any questions?
No, I don't.
Okay. Well, thanks for watching. See you next time.